Hi, my name's Caroline Hairwagen. I'm the COO of Oral Essentials. As a new brand, I run into a lot of questions about what makes us different, why are we special, and I always find it's the best to direct all of those questions to the man himself, the creator of Oral Essentials, Dr. Maddahi. Hi, Dr. Maddahi.
Hello, Caroline.
How are you doing today?
Good, good.
Good. So I have a few questions for you about Oral Essentials. The first one is, as a dentist for 30 years, running a successful dental practice in Beverly Hills, on TV, on radio, what made you want to start your own oral care line?
Believe it or not, I was trying to handle my own problem, what I was running into in my own office with my own patients. As you mentioned, I've been on a lot of makeover shows, and the amount of pressure that comes with trying to do something as perfectly as possible and as quickly as possible always led me to try to figure out how to overcome these challenges. One of the main problems I kept running into was when I was doing crowns and veneers or smile makeovers. I'm using temporaries in the interim stage before the crown or the veneer is fabricated in the lab. The material is acrylic and it is an irritant to the gum, so the patient cannot floss their teeth. The gums are sore, so the brushing is a little bit difficult. And on top of it, you've got a material that is an irritant. So by the time it would come to the point of removing the temporaries, the gums are very inflamed, there's a lot of bleeding that would interfere with the perfection of the work. So I started to use all sorts of different brands of mouthwash, from the ones that are prescription-based, to the ones that you buy in the markets, to the natural kind, whatever I could get my hands on, to try to control the inflammation around the gums, control the bleeding around the gums. And I couldn't. And that frustration led me to try to figure out a way as to how I could handle that problem. Therefore, I went and created my own mouthwash and toothpaste in order to handle that problem in my own office for my own patients initially.
There are not many natural products that are dentist formulated, dentist recommended, and actually in dental offices. What makes Oral Essentials different?
So as a cosmetic dentist, number one, I was always concerned about the whiteness of people's teeth. Everybody wants whiter teeth.
Definitely.
And that's why the whole use of whitening products has gone through the roof. So why would we use artificial dyes in our oral care line? Why do we have blue, green, yellow, purple mouthwashes? So that was the first thing that didn't make any sense to me. So we made Oral Essentials to be dye-free. So you use a clear liquid, number one. Number two is that as dentists, we're very much concerned about oral cancer. And when we do oral cancer screening exams, we're always asking if the person is a tobacco user or uses alcohol. So why would we put 20 to 25% alcohol into the mouthwash? That didn't make any sense to me.
That's a good question.
And then the third part was, growing up, I've always heard my mom, my grandma talking about gargling with salt water. I even tell my patients to gargle with warm salt water because if they have a cut in their mouth, or if I want something to heal faster or better. What happened to salt in our oral care line? So having that in mind, I wanted to create a product that was dye-free, preservative-free, alcohol-free, and also integrated salt into it.
What separates Oral Essentials from the pharmaceutical or more traditional brands that most people use?
This is one of my favorite questions that I hear. I think the first part of it is, beside the fact that it is dye-free, preservative-free, alcohol-free, it uses sea salt in it, the more major part of it would be the fact that it is non-toxic. So logically, you would always think, why would you put something that's toxic in your mouth or into your body? But what people fail to realize is that all of the major brands or the pharmaceutical kinds of oral care have either dyes, alcohol, or other chemicals that would be cytotoxic. And cytotoxic means that it kills good cells. That is one of the reasons why there's always warning on these bottles, do not swallow, if you swallow, please seek medical help. Because it is harmful.
Right.
So the one thing that I wanted to make sure was that our product, it is actually non-toxic. So if somebody accidentally swallows it, nothing happens to them. So the fact that it is non-toxic and it has been tested to make sure against the most sensitive embryonic cells, it does not harm it at all. We know that this is one of the biggest differentiating points between our brand and the traditional brands.
Oh, wow. What kind of results and feedback are you getting from patients that you see in your office?
This is also a very interesting question because I was testing it on my patients where I was restoring, doing full mouth restorations, smile makeovers with temporaries, that there is a special level of inflammation of the gum. The material is making it more irritable to the gum. So I was using it first initially on those patients.
So they were guinea pigs.
So they were the guinea pigs, right? And because it is sort of has salt, essential oils, xylitol, aloe vera juice, nobody really objected as to why you're giving me this or is it harmful or not. Because inherently people know these are the good things for you.
Right.
So I wanted to know when I am doing someone's smile and I use the temporaries and I take the temporaries off, and if the patient is actually using the mouthwash twice a day for 60 seconds, what will happen to the gums when I remove the temporary? And interestingly enough, patient after patient after patient after patient, what happened was when I removed the temporaries, there was hardly any bleeding. There was hardly any inflammation.
And that was not normal.
Not at all. How could you have a situation where the patient cannot floss and you have something as an irritant to the gum that normally causes inflammation, all of a sudden you remove the temporaries and there is not much of bleeding and there's not much of an inflammation. This is not something that I have seen in 30 years of dentistry. I have not come across any product that was doing that. So initially, I didn't want to even make a mouthwash or toothpaste or anything. All I wanted to do was help my patients and be able to make my work sort of more perfect and the quality, make it better and make it more efficient. But the results were so good that I decided that I got to put this out there. So for other dentists, for other patients to be able to use it.
How are you working to make this the premier product on the market?
I think the ingredients is the number one answer I would give to this question. We started in terms of what would it be the best ingredients that we need in terms of improving someone's oral care, okay? And for that, I consulted a colleague of mine, Dr. Hessam Nozari, who was the chairman of the perio department at USC for 17 years. He has a lot of research, a lot of published articles.
Gum specialist.
Gum specialist. And the main article that I came across that caught my attention was a 10-year unprecedented study on homeless kids in Manila. And these homeless kids had early stages of gum disease. And what was told to them was to rub sea salt on their gums twice a day. So homeless kids don't really have toothbrush, floss, toothpaste. So what is the cheapest way of trying to handle their problem? And that was his solution to that problem. And what he did is that he followed these children over a 10-year period. And these children are affected by AA bacteria. The interesting part of this research was after 10 years, there was no gum disease. Yet the AA bacteria still existed in the patient's mouth.
So what does that mean?
All the kids still had the bacteria, yet there was no disease. This brings us to a very key aspect of the type of bacteria you have in the mouth and how you should treat them. The main part of what I have been trying to talk about for the past 2 years is that we don't want to go around killing bacteria. All of these antimicrobial, antibacterial types of mouthwashes is not what we should be using. And the vindication of what I'm talking about also came out in September with the final FDA ruling on hand soaps and body washes, the kind that has the antimicrobial, antibacterial soaps or antibacterial body washes. And what FDA found out is that there's no difference between those types of products versus just washing your hand with regular soap. And the second part is that when you're using ingredients in your product, is it altering hormones? Is it causing cancer? Is it causing some sort of a bad side effect? And those products were. And those ingredients were. And then the third, and I think it's the biggest concept that is sort of revolutionary, but it actually makes sense, is that if you can kill bacteria and you use antibacterial or antimicrobial types of ingredients, all you're going to do, you're going to create resistant bacteria.
Superbugs.
Superbugs. And that's what we're actually suffering from in society. There's 22,000 people that die every year because of superbugs, and these are man-made bacteria. It's not something that's newly coming into society. As we use more of these types of products, we're making the bacteria more resistant. As a result, we're getting superbugs. Wow. But there's an interesting part to this. So let's say you use antimicrobial, antibacterial type of products, and you get these resistant bacteria. You still can transfer it to someone else in your household. So the transference of it is also a danger. So it's not only having resistant bacteria, but the also transferring of the resistant bacteria to others can make this be more spread out. As a result, one of the key parts of Oral Essentials is that we want to not kill bacteria, but yet keep the whole equilibrium of the oral flora. The type of bacteria you have in the mouth, 99% of them are good bacteria. We need bacteria to live. We need bacteria to survive. We need bacteria in order to have vitamins be produced in our body. This concept of killing bacteria, it is not correct. And you can see that sort of because there's so many people are taking probiotics.
Yeah.
Right?
Yeah.
So what is probiotics?
You're putting yogurt.
Yogurt, right? Greek yogurt, this
Yeah.
yogurt, that thing, and taking probiotic pills and all these things. Why are we killing bacteria and then we're using probiotics? See, that's what doesn't make sense. So using ingredients that you absolutely need. So the things that we knew we absolutely need, number one starts with sea salt. And then we decided to take on Dead Sea salt because it has the highest mineral content of any salt. So as an example, table salt is 98% sodium. So all the bad things you hear about salt causing blood pressure problems and everything, that's table salt. Sea salt has only 80% sodium and 20% minerals. Dead Sea salt has about 14 to 16% sodium, and the rest of it is minerals.
Oh, wow.
So these minerals have such health benefits. That's why so many people from all around the world travel to Dead Sea to go into that water, right? So
it's not just so they can float?
Not just to float, but the floating is a sort of an added bonus.
Okay. Right.
But so when you look at it, is that whenever you take some sort of a pill, some sort of a drug, there's side effects. So people go to the Dead Sea, there are psoriasis of the skin. When they go into the water, what is being affected is the area where the psoriasis is, where the skin disease is. The normal skin doesn't get harmed in any way. And what we want to do in the mouth is we want to neutralize the toxins of the bacteria. We don't care about the bacteria. If we neutralize the toxins, as a result, we will have a much better environment in the mouth. And doesn't mean going and killing all these bacteria.
What's the most exciting thing about this product, in your opinion and experience?
I think the most exciting part of Oral Essentials is that I pretty much decided that there are 4 types of patients that I see in my office. There are patients that are concerned about their gum health, and they don't want to have gingivitis, or they have gingivitis. And we created a product specially for them, which is the original mouthwash. Then I have patients that are much more concerned about the color of their teeth. They want whitening, but they don't want the sensitivity. And they want to be able to use something that they can use on a daily basis because they drink tea, coffee, red wine, blueberry, blackberry, and all these different things. And our whitening mouthwash has coconut oil, sage oil, and lemon peel oil, in addition to all of the ingredients that is in the original mouthwash that creates that whitening. And then the third group of people that I see are people that have sensitive teeth. Sensitive teeth due to wear of the enamel, sensitive teeth due to too much whitening products being used. Either their toothpaste or whitening mouthwashes, hydrogen peroxides, and all these different things have broken down the enamel to the point that they have sensitivity to hot, cold, or any type of temperature changes in their mouth. So our sensitivity mouthwash is also taking care of those group of people with much higher concentration of Dead Sea salt with this mineral content. And the fourth group, I think this is the group that is overlooked to some degree. And having worked with patients, young and old, seeing the rampant cavities in their mouth and sort of not knowing as to why, it turned me on to this aspect of this particular mouthwash, which is our dry mouth mouthwash. So dry mouth, I think, as I mentioned in my latest book that I wrote, The Hidden Epidemics, is the part of the trend that I see in the future that is going to cause a lot of tooth decay, a lot of extractions, a lot of destructions of teeth. So for the first 10, 15 years of my practice, I hardly saw people having that much cavities. In the past 10, 15 years, I'm seeing a rampant growth of cavities in my patients' mouths. And part of that is either they're on different medications, they're mouth breathers, there's something causing dry mouth. So when you go on the site for CDC, Center for Disease Control, and you type what causes dry mouth, there's a list of medications that come up. It starts with antidepressants, anti-anxiety medication, antipsychotics, blood pressure medications, heart medications, allergic medications. So people that have allergies that they cannot really breathe through their nose, they're constantly breathing through their mouth. As a result, it's causing dry mouth. Now, why is that important? Because saliva is the number one defense mechanism that the body and the mouth has toward what is going on and what's coming into it. It's sort of an antibiotic in itself. And when you don't have saliva, the cavity-causing bacteria run rampant. As a result, you're going to have all these types of cavities, and the cavities get bigger, and then teeth start to fall off. And in one of the shows that I did on a patient in the doctors, it's a 31-year-old man that has never abused drug. He was diagnosed with a rare genetic disease on his legs. He was in a lot of pain. He was given a lot of pain medication. After 4 years, he had none of his teeth left in his mouth.
Wow.
All rotten to the gum line. So imagine being 31 years old, somebody not telling you why the teeth are getting ruined. You have no idea, yet you're in so much pain as a result of other problems that you have, and you have to take this medication. So the psychological effect and also the cost of handling these types of patients in the future is something that is in the forefront of what I'm constantly trying to figure out as to how to handle. So our dry mouth mouthwash is using coconut oil and grapeseed oil as a lubricant, and it's using cayenne pepper oil as an irritant to increase the saliva flow. Pretty much all of the things that I have seen falls within these 4 categories. So as a company, we decided that we want to handle all of these 4 patients, 4 categories of situations that come up with natural ingredients, and we have been able to do that. And what makes it even more exciting is that now the testing shows that when we use our whitening mouthwash against a leading brand mouthwash, we're getting same results for 3-4 months of use. And you cannot really use whitening mouthwashes that have hydrogen peroxide for 4 months. Your teeth will be too sensitive.
Right.
So we have found an alternative with naturally derived ingredients to sort of mimic chemicals, hydrogen peroxide, or other things that were being used in mouthwashes to handle problems. And I think that's what makes it so exciting.
That is exciting.
It is.
What are the long-term goals of Oral Essentials?
I think the long-term goal of Oral Essentials is to create an entire line of oral care products, being with the mouthwash, the toothpaste, floss, toothbrush, lozenges, all sorts of things that are all environmentally friendly, they're non-toxic, and they're actually effective. So you can have a lot of healthy products that are ineffective. And I think the biggest letdown in the oral care market has been there's a lot of natural products that doesn't really do anything, and you have lots of traditional products that are cytotoxic. And you have multi-billion-dollar companies that are running ads and making people thinking that like burning of the mouth is something that's good. It's the alcohol that's burning the mouth. It's absolutely not okay. Right. Or using so much mint as a masking agent is okay. That's not okay. That's not really handling anything that would freshen the breath. So really tackling what is it there that's necessary in order to address all of these issues.
Oral Essentials is more expensive than some of the other products on the market. Why is that?
I wanted to use the best ingredients, what's absolutely necessary, what is absolutely most effective, and make sure that there's nothing in there that would be toxic, and at the same time, not compromise on the quality. So starting with the package, the bottle that we use is a BPA-free type of a bottle so that there's no toxic gases being produced. When we get into the ingredients, starting with the salt, we could have used table salt, which has a lot of sodium, doesn't do very much. We could have used regular sea salt, but we decided to use Dead Sea salt and import it from the Dead Sea because of its all of the high mineral content. When we get to the essential oils, I could have used a lot of different essential oils, and I tried a lot of them. The one that I found to be the most potent, highest level of quality, was the one from France. So we ended up importing 4 to 5 different kinds of essential oils that helps with breaking up the plaque and all of its benefits in the mouth. So we ended up using the one that we import from France. I could have used sodium saccharin. Instead, I'm using xylitol, one of the ingredients that can cause reduction in cavities because the cavity-causing bacteria cannot actually process xylitol. There's such variables in terms of what you can use to go cheaper, but the cheaper is not better, is not what is good for you. And then in terms of using alcohol or dyes or other things, we're using organic aloe vera juice in order to soothe the gums. So every single ingredient is what you absolutely need. And also, I didn't want a sort of a natural product that doesn't taste good. So I had to make sure not only the ingredients are good, they are highest quality, what someone would absolutely need, but also it tastes good. So I experimented with having ginger really destroy the taste. I didn't put tea tree oil because it was killing too many bacteria. The antimicrobial effect of it is something I didn't want. So all of these, when you put together, it creates a product that becomes a lot more expensive. But you're living in a day and age that you buy bottled water. Water is free. People pay $2, $3, $4 for that water. Mm-hmm. There has to be something that is in it that people are attracted to it. I don't understand and design and the packaging and everything else. So I don't really get how we can have products that are only costing $3, $4, which is higher than the cost of my own product, but they're selling it for $3 and $4. And that's where the main differentiation point comes from. If one really cares about their mouth, one really cares about their oral care, and there's plenty of studies that have shown what's happening in the mouth affects the rest of the body. So diabetes, heart disease, preterm babies as a result of women that are pregnant and have gum disease. So we know that there's already a link between what's happening in the mouth and the rest of the body. Why aren't we paying more attention to what we're putting in our mouth? Why is it okay to put these types of products that are out there in the mouth that don't cost very much, but they don't do anything good. And some of them actually do more harm than anything that's good. So if one really cares to research each of those ingredients that are in the back of the labels, see how many of those they can actually pronounce, and find out what they're good for or why they're there, they'll understand in order to have something that is good and effective, it costs more. There's no two ways about it.
And they should care, it seems.
100%.